How do you diagnose cervical cancer? The diagnosis of cervical cancer is most commonly done by the treating doctor, who is commonly a gynecologist. The gynecologist will first do a complete clinical examination, especially in women who have symptoms of bleeding per vagina or foul smelling odor coming from the vagina. The instrument which is used to examine the cervix is a colposcope, which is a spoon-shaped instrument which is inserted into the vagina to expose the cervix. Using this instrument, the gynecologist is able to take a sample for both a pap smear, or is also able to take a biopsy in case there are any suspicious lesions present. The biopsy is then sent for a pathological examination, and the final report will tell whether there is the presence of a cervical cancer or not. The second test which is done for the diagnosis is known as an endocervical curettage test, where an instrument which is known as a curette is used to scrape the wall of the cervix to collect tissue, and this tissue is then sent again for pathological examination, and we can detect whether there is cancer in that sample or not. Other than this, after we get a diagnosis of carcinoma cervix, we have to do a complete staging evaluation. A staging evaluation is more required to look to see whether there is disease which has spread to other parts of the body. The most common tests that we do for the detection of the spread of cancer and for staging is a CT scan, an MRI scan, or a PET scan. Depending on the staging and the diagnosis, we prepare a treatment plan for the management of carcinoma cervix. Okay.